October is Breast Cancer Awareness Month, and Christus St. Patrick Hospital is leading the way by being the first facility to offer 3D mammogram. Michelle and Londa Baker are here. A little bit about what this is and what's the difference between a regular mammogram and a 3D mammogram.
Well, for the 3D mammogram, the x-ray tube actually sweeps from one side of the breast to the other. It produces what we call 15 projections, and it goes from the bottom of the breast to the top.
Okay, so you get you get more detail, you get a better image, or what is it that is improved from the doctor's side?
You get more detail, especially with these women that have really dense breasts. They're able to see all the way through the breast instead of just a 2D.
All right, and I guess the question most women want to know, because no one enjoys getting their mammogram, although we all need to do it. Does it take any longer? Is it a different kind of process? How does the actual process work once we're in there?
The process is the same. You still have to be compressed. The only difference is the tube head that moves over, and it takes 12 seconds longer. 12
seconds is nothing to get a better picture.
Exactly.
All right.
Exactly.
I know there's been a lot of confusion over the past few years about screening guidelines. It seems like it changes, and a lot of us aren't exactly sure what we need to do and when we need to do it. Can you clear that up for us?
Yes. My recommendation is, number one, that you talk with your healthcare provider to come up with an individualized screening plan for yourself, because it has been confusing with the American Cancer Society now recommending age 45 to start screening, and then the United States Protective Task Force is recommending age 50 to start. But each woman has their own individual family history and risk factors, and that's a one-on-one conversation. And there are even some people that need to start screenings in their 20s or 30s, depending on family history. And we're glad to help you with that at the Christus Women's Health Center.
Okay, and if someone maybe haven't seen their doctor in a while, do they need to have a doctor's order to be able to go get that screening mammogram, or how does that work?
You do have to be established with the doctor, because we have to have someone that we can send the report to. But if you're not having any problems, the screening, you do not have to have an order. Okay,
you need to call the Christus Women's Health Center on Country Club Road, and they can step you through that process and get you going.
That's correct.
Okay. Tell us a little bit about the 3D technology, and do you see this as being a lifesaver, or do you think this is a game changer as far as mammograms go?
Oh, I think so, definitely. And it eliminates some false positives, because we're looking at the images in more layers, and so things that may look suspicious with less detailed images clearly. So it should eliminate some unnecessary biopsies. But for those small cancers that are hiding behind other structures, maybe weren't seen so clearly before, when we have these thin slices, it's kind of like flipping through a book. That when the radiologist reads those pictures, he's so much more detailed.
All right, this is the first in the area, and of course we encouraged everyone, especially during the month of October, to make sure you get that mammogram set up and get that screening done, and you can give them a call. You see the number was on the screen, but either way, call the Christus Women's Health Center on Country Club Road and get that set up for yourself or for someone you love. Thanks for coming in today.
Thank you.
Good seeing you both. Well, up next, Exploring Louisiana. We're going to be right back.
I was only